on Coleman. Count on Coleman. If your world is looking strange, you can count on Coleman for change.
Hi, Baton Rouge. Yes, District 10 for sure. Here we are at the Coleman Cares podcast, where we do our level best to educate the people, and that's you. I am so grateful today to have with me and I've been around a long time, to have one of the best, the most efficient, great bedside manners, the whole knowledgeable, the whole 9 yard. Physical therapist here with me today, and this is Dr. Tierra Williams. And guess what? You guessed it. Dr. Tierra is right here at the Leo S. Butler Center, and that's the part that really does my heart well. She is here and serving and serving and serving, and that's what it's all about. And so I am grateful to allow her to just share with the listening audience about herself, who she is, where she came from, and what got her to this place. So I say, welcome, Dr. Tierra Williams.
Thank you. Thank you so much for that warm welcome. I really appreciate it. Thanks for inviting me to the podcast. But yes, I'm originally from Baton Rouge, actually grew up in North Baton Rouge area. So I attended East Baton Rouge Parish schools throughout grade school, and graduate of Bel Air High School.
All of that public school, right?
Yes,
and
good,
here you
good
are.
education,
That's right.
a wonderful education.
That's it.
And I knew I wanted to become a physical therapist, and I always had a special place for science. So I was a biology major at Southeastern Louisiana University in Hammond. And but I did go on and pursue physical therapy at Alabama State University in Montgomery, Alabama. So I was out there for a long time, but I returned here to Baton Rouge. It was about 2017.
You all heard it. She returned to Baton Rouge. So that's the great thing when we talk about our young people leaving. You leave, you do what you need to do, but you return home. Dorothy says that there's no place like home. What are some of and she's an HBCU graduate. Right. And so you all better listen and get all of this. You're talking about a HBCU graduate. You're talking about one who went to the public schools here in Baton Rouge, and then is so successful now as the doctor of physical therapy. So, Doc, what are some of the common misconceptions that people have about physical therapy?
I think the most common misconception is that physical therapy is painful. And they have all kind of nicknames for the physical therapists, but we are really here to help people, help you feel better, regain your function, your mobility, reduce your pains. And there's lots of different ways to do that are not painful, to say. It's all about listening to the patient, hearing what makes them feel better, what makes them feel worse, and from there deciding the plan of care for the patient.
And that's exactly what you do. And so folk don't realize that it's not just exercise, moving those muscles, but it's a combination of things that you do, that dry needling and all of that. So share that with the listening audience there.
So, of course, with physical therapy, it's very common. You see the electrical stimulation or TENS machines being used. You'll see the hot packs, the cold packs, ultrasound. Those are very, very common. But other things we also use would include the kinesio taping to give the joints more stability. We use cupping. That's the suctioning technique of the silicone or the plastic cups, which lifts up the skin layers, allowing more blood flow to the area, which relaxes the muscles, nourishes the joints. And then an even more invasive technique that we do is called the dry needling. So that is very similar to the acupuncture needles, but we actually have specific needles for dry needling as well. And with those, we insert those into the trigger points of the muscles. And when you do that, that stimulates that inflammatory response, that increase in blood flow, helps relax the muscles and or any nerve or joint pain that's occurring. So it's quite beneficial, just speeds up the recovery faster than just doing exercises. Just helps make your recovery a little bit more efficient for you.
And so, you know what? You all have just gotten a biology lesson. You're not going to tell me that you knew all of this great stuff here about physical therapy. You thought it was just some old mundane exercise and that makes up physical therapy, but not with Doc here. She does it all. And when you do your part, talk to us about the responsibility of the patient and what are your expectations are when you have done your thing. You've done what you need to do.
Yes. So the responsibility of the patient is seeking out the proper healthcare provider for what you have going on. When you notice something is different, you're moving slower, you're having falls, you're starting to have some pain, you need to let your doctor know or whoever your first line of providers, let that provider know so they can get you to the physical therapist. And the next step, once you get that physical therapy referral, is showing up. All right? That's half the battle, because I think the biggest fear is, oh my goodness, I don't know, and what are they going to do? But make it to that evaluation appointment so that you can see what the benefits are, what they have to offer you, and follow through with it. One thing about physical therapy, the therapist is there and they're going to help you, but they can't do everything. They can't. So you have to follow that exercise program that's given to you to do at home to help speed up that process. If not, if you're only doing what you do when you come to therapy, the process will be a little bit longer. But it takes you doing some self-reflection as well to get better.
You heard her, and I tell you what, very thorough. I can tell you all this, and I'm talking from firsthand here. Very thorough with her examination, thorough with her note writing, thorough with all of her processes. And so that's what makes a great physical therapist. You all know that. What are some simple habits, Doc, that you would recommend that more people would practice to stay mobile, to stay pain-free, to stay not having to not having to have physical therapy.
Right. So what's most important is that we all have a regular exercise routine, not just what you're doing if you have to go to physical therapy, but what you're doing in the community, taking walks, riding your bike, swimming, whatever type of exercise that you enjoy, and being consistent with it. Because College of Sports Medicine recommends that we all get 3 to 5 days a week of physical therapy, at least 30 to 50 minutes. So, of course, you can start off doing 5 minutes. If you have to do 5 minutes on the stationary bike, and then build it up slowly till you could do 10 and 15 and so on until you can make it to that 30 minutes. So that's very important to keep your muscles strong, your joints flexible, and even more than that is the foods that we are eating, what
yes.
we're putting inside of our bodies.
Yes.
So there are foods that create more inflammation in your body. So sometimes you want to stay away from that if you're having pain. And then just have a healthy, balanced diet. Fruits and vegetables, not lots of sugars. Sugars definitely increase inflammation in your body. White breads, white pastas. So you want to be careful or stay away from those things, especially if you're having discomfort.
You all heard the doctor here. She's telling you what to do and what to eat if you want to stay healthy, and that is of utmost importance, Doc. You know, so often we talk about keep it moving, just keep moving. It's in the movement there, and I don't know of in very few folk who continuously move in some sort of way. Just don't they. Very few end up, I should say, in a posture where they don't want to be, as long as they keep it moving and moving in the right vein there. And so physical therapy has truly evolved in recent years. And so where do you see this profession heading? Where do you see it heading?
Physical therapy just continues to grow from where it, was years ago. Because one thing about physical therapy is that we now have direct access, so that patients don't actually have to have a physical therapy referral to start physical therapy. It helps to have it if you're using your insurance, but we do have the ability to see you now without a referral if you're doing a cash base. So sometimes you want to come right on in and you don't have to have that doctor's visit first. We can work with you on that. Now, there is that situation with certain insurances. You have to have that referral in place. So having direct access, which most states do at this point, has been a big step where people can have a little bit more independence in what they're doing and have access to us. Other things is that our physical therapy profession, we're growing and trying to reach people where they are, and even those higher level people who are fitness fanatics and doing CrossFit. We're even in our continuing education learning how to treat those patients who are doing the higher level activities and working with athletes as well.
And so you said an interesting word there, education. So let's talk to the young people out there who may be interested in being the next Dr. Tierra Williams, right along beside her or afterward or whatever. It all depends on where they are in school. But let's talk to these young people about what it entails in order to get to where you are now. And then also, as you said, there's continuing ed classes too. that's a must-do activity. But talk to them about what it takes.
Yes. So definitely, if you know you're going to college, you know you're going to graduate school, you know you need to have good grades academically. So because once you get into that physical therapy program, you're going to have to maintain a good GPA, at least a 3.0 or above, to pass your classes and stay in the program. So definitely you want to have good study habits, good time management skills. So getting into physical therapy, when you're an undergrad, you can have any major. Most people do biology or exercise science, athletic training, because there are prerequisites that you need to have to get into physical therapy school. And so once you're in physical therapy school, it is a 3-year program, a clinical doctorate of physical therapy. So, and now there are some that are like, no, I do not want to go 4 years undergrad, 3 years graduate school. There are other options. We have a physical therapy assistant title as well. With the physical therapy assistance, that's an associate's degree. It's a 2-year degree. There are some prerequisites that have to be met, but we have a local program at Fran U. We have a program at Delgado for physical therapy assistant. So, and we have multiple programs now in Louisiana for physical therapy school. When I first came out of high school in 1999, there was 2 programs, either LSU New Orleans or LSU Shreveport. So now we have multiple programs, and I believe even Xavier is beginning a program. Mm-hmm.
Wow. So I could be Doc's assistant, y'all. Yes, I could be. Yes, indeed. And so you all heard that, young people. She went to an HBCU, she went to public school, but she was disciplined. She took care of her business. And here Doc said right today, it is doable with no excuses, just a lot of hard work. What about our constituents out there? Tell me, what is it, some advice that you could give to them, or what you would ask them to do to help you do? You here at the Leo S. Butler Center, what is it that they can do, or any little advice, any little nuggets that you could give to the listening audience?
Well, I just think the number one thing to do is to listen to your body. And when you notice that something is different, you want to go and see what is going on, what is different. Have a good communication with your doctor, your provider, and just make it known your needs. And if it's a provider that you're not comfortable with talking to, then that may not be the provider. You need to find a new provider that is listening to you. That's so important. You have someone who is listening to you on your healthcare team to get you where you need to be for any specialty services. So that's my number one thing, is listening to your body, working on reducing the inflammation in your body, and then just calling out all the healthcare professionals to, keep patients number one and listen to your patients. And my motto is helping as many people as I can.
And on that note there, constituents, she's here at the Leo S. Butler Center, and I would say that you can definitely help spread that word to let them know that we have the best physical therapists that you could definitely have their hands laid on you that anyone can get. And that is Dr. Tierra Williams right here at the Leo S. Butler Center. So Doc, tell them how to get in touch with you and all of that great stuff.
All All right, so you can definitely reach me by phone, 225-306-3013, my website, www.empowerptw.net, or by email. And I'm also on Instagram, EmpowerPTBR. And I'm here at the Leo S. Butler Center.
That's
So
right.
stop by.
There you go. You heard it. And so she gave something for everybody. If you only use the telephone, she gave you that. If you want the internet, she gave you that. So you cannot miss Doc. And she also told you where she was, here at the Leo S. Butler Center. So come over, walk over, come and see the whole 9 yards, and then help to, have conversations with persons out there that would be in need of some great physical therapy. So keep that in mind. And so, listening audience, as we come to a close, we remind you to share, subscribe, the whole 9 yards, and just listen, look and listen here at the Coleman Cares. And I just thank you for joining us today. Anything, Doc, that we missed? Anything else that you want to say?
I think that's all. I think we covered it all.
Oh.
But yes, if you need any therapy, come see me.
There you go. And so we thank you. I thank you for joining us this time. And just remember, Coleman Cares.
Count on Coleman. Count on Coleman. If your world is looking strange, you can count on Coleman for change.